Welcome again to another of my series on surgery for undergraduates. Today's topic for discussion is hemorrhoids, which is a very common cause of PR bleeding in adult patients. Now, what are hemorrhoids? Hemorrhoids are swollen veins in the lower anus and rectum. They are also commonly referred to as piles, which are actually blood vessels inside the anal canal, which become engorged and dilated with straining and constipation. And eventually they tend to bleed and even drop off. Here this is an anal canal with the piles here. They become engorged, dilated due to frequent straining at stools, and later they tend to bleed. This is a picture showing you a close-up diagrammatic view of what hemorrhoids is. On the left here is normal venous supply, or the venous anatomical situation of the venous. That's a internal venous system and your external venous system. Here on the right side it shows the venous veins have become dilated and tortuous, forming hemorrhoids or piles. This is an internal piles and this is an external pile. Internal piles occur inside the anal canal and are not easily visible outside. There are some fast facts on hemorrhoids. Women are more likely to get hemorrhoids while they are pregnant. The likelihood of developing hemorrhoid increases with age. So in children, we rarely get hemorrhoids. Hemorrhoids occur when the veins surrounding the anus are engorged and enlarged. If left neglected, hemorrhoids can cause chronic bleeding and anemia. Sometimes medication and surgery are needed to treat hemorrhoids and its complications. What are the types of hemorrhoids that we have? First, we have the internal hemorrhoids, which I mentioned just now, which originate high up in the anal canal or lower rectum. These are drained through the superior rectal vein into the portal system. External hemorrhoids originate in the anus, lower anus, and drain through the inferior rectal vein into the inferior vena cava. Between these two venous systems, there is a rich anastomosis that exists between these two and the middle rectal vein, thus connecting the portal and systemic circulations. This is the blood supply, arterial supply of the hemorrhoids, upper rectum, middle rectum, and lower rectum. So the hemorrhoids occur here. The upper rectum is supplied by the inferior mesenteric artery through its superior rectal branches. The middle rectum is supplied by the middle rectal arteries, which comes from the internal iliac artery. And the inferior rectal artery supplies the anus and the anal canal. And this also comes from the common internal iliac artery. Over to the venous side, again there are three sets of veins that drain the rectum and the anal canal. The upper is known as the superior rectal vein, which drains into the inferior mesenteric vein and finally reaches the portal vein. So it belongs to the portal system of venous drainage. The middle and the lower rectal veins drain into the internal iliac vein, which then empties into the inferior vena cava, which belongs to the systemic circulation. So in this area of the anorectal region, there exists a rich anastomosis between the veins of the systemic and portal system, creating a portosystemic shunt, which becomes important in cases of portal hypertension due to cirrhosis of the liver, where these veins tend to become piles or dilated to become hemorrhoids. Now, we come to external hemorrhoids. These are hemorrhoids under the skin around the anus. And signs of these symptoms of these external hemorrhoids include itching or irritation in the anal region, pain or discomfort around the anal region, swelling around the anus, and bleeding. Internal hemorrhoids, on the other hand, lie inside the rectum, so you can't really see or feel them, and they rarely cause discomfort. But straining or irritation when passing stool can cause painless bleeding during bowel movements. Okay, this is the most common symptom of internal hemorrhoids: painless bleeding during bowel habits and classically after defecation. This can also lead to hemorrhoid prolapse, okay, and this results in pain and irritation in the anorectal region. The third category we can include is the thrombosed piles or thrombosed hemorrhoids. Okay, when the blood in the external hemorrhoid veins clot, then that is known as thrombus, and such a hemorrhoid is known as thrombosed hemorrhoids. This usually causes severe pain in the anal region, swelling, inflammation, and a tense lump near your anus. External thrombosed hemorrhoids are usually found in the external hemorrhoids around there as a tense lump around near the anus. What are the causes of hemorrhoids? The underlying cause is an increase in pressure in the lower rectum, and this is due to straining during bowel movements, sitting for long periods of time on the toilet bowl, having chronic diarrhea or constipation, being obese, pregnant, low fiber diet, and regular heavy lifting, lifting of heavy loads, which increases the pressure in the lower rectum. The clinical features include painless rectal bleeding. Remember, I emphasize the word painless because bleeding, classical bleeding from hemorrhoids is painless. Feeling of fullness or discomfort in the rectum, sensation of needing to defecate, pain in the rectum, especially when there are complications of the hemorrhoids like prolapse and thrombosis or infection, anal pain, especially from external hemorrhoids which are thrombosed, and itching feeling near the anus. Okay, internal hemorrhoids can be graded according to their severity into grade 1 to grade 4. Grade 1 or first degree is when there's no prolapse, no prominent blood vessels are seen, and on examination there's nothing much to see except on proctoscopy you'll see prominent blood vessels in the area of the internal hemorrhoids. Grade 2 or second degree is when these internal hemorrhoids prolapses out on defecation, prolapse upon bearing down, but reduce spontaneously. So after defecation, it returns to its original position. Grade 3 or third degree prolapse upon bearing down and requiring manual reduction. So the hemorrhoids prolapses on bearing down, and after defecation, it fails to return to its original position. The patient has to manually push it back, which moves in easily back to its original position. So requires manual reduction. In grade 4 or the fourth degree is prolapse on defecation or on bearing down and unable to be manually reduced. And the prolapse mass remains permanently outside, fail to be reduced manually. So these are the four categories or grades of hemorrhoids, which are important as the treatment depends on these grades. Now, when you look at the hemorrhoid patient, you see the prolapse hemorrhoids here. This is the anus. You can describe them in according to the face of a clock. These are the primary hemorrhoids which occur at the 11 o'clock position or the right anterior, 3 o'clock position, left lateral, and a 7 o'clock position, which is a right posterior. In between these prolapse primary hemorrhoids are known as the secondary hemorrhoids. Okay, so these three primary hemorrhoids correspond to the three branches of the superior rectal artery which continue to supply these three structures. Okay, next we come to complications. Anemia is one of the common complications of hemorrhoids. Chronic bleeding leads to anemia. Sometimes it can also result in acute bleeding, causing hemorrhagic shock, which needing emergency treatment. Okay, prolapse and strangulated hemorrhoids. If the blood supply of the internal hemorrhoid is strangulated or cut off, the hemorrhoid becomes strangulated, which causes extreme pain. Thrombosed hemorrhoid, the hemorrhoid becomes thrombosed, and this may not be a dangerous situation, but is extremely painful and needs to be drained as soon as possible. And the last complication is infection and sepsis, which lead to local abscess formation, perianal abscesses, or it can cause portal pyemia, okay, and which can lead to liver abscess, which is a very serious complication. Okay, but how do you prevent hemorrhoids? The underlying mechanism to prevent hemorrhoids, to keep hemorrhoids away, is to keep your stool soft so that the stools pass easily. Okay, so less training, soft stools, less training, less hemorrhoids. Eat high fiber food, plenty of water, of oral fluids. Consider taking fiber supplements. Avoid straining at stools. Go as soon as you feel the urge and not wait until you have to strain and push the stools out. Regular exercises and a healthy lifestyle. And one of the important things is to avoid long periods of sitting, especially jobs that require you to sit for long, like drivers, okay, who have to sit for hours without rest. Next, we come to the treatment of hemorrhoids. First, conservative measures. Okay, the first conservative measures will be diet, as I've mentioned, high fiber diet, increase a lot of fluids, stool softeners, and such as Senecort, okay, we soften the stool so that there's less straining at defecation. If there's prolapse or thrombosis, then there's local applications may be of help. Xylopox ointment is a local anesthetic ointment. Proctosidil ointment, which is a combination of steroid, hydrocort, antibiotic, and local anesthetic. And Elma cream. This is a Tignocaine ointment, which is a local anesthetic. So all these local applications usually consist of a local anesthetic, steroids, and antibiotics. These are three components, okay, which are used in the manufacture of local applications for hemorrhoids, especially complicated hemorrhoids. Then there's the Either these can be used as ointment to apply locally, or they can be used as suppository, where you insert these bullet-like ointments or bullet-like medication through the anus into the anal canal. Among them, anusol is a very important and popular suppository that has been used for very long, which consists of hydrocortisone acetate. Then the drugs used to treat hemorrhoids is Deflon, okay, 500 milligram. This Deflon increases the venous tone of the hemorrhoids, so thereby reducing the stasis and engorgement of the veins, thereby the pressure in them. This therefore decreases the symptoms of pain, edema, and irritation. Apart from these conservative measures, next we have is the more invasive methods of treatment. Among them will be the injection sclerotherapy, which uses 5% phenol or 1% thromboa, which is injected into the veins, hemorrhoids, especially second-degree hemorrhoids, to cause them to sclerose and fibrosis, thereby stopping the bleeding. Ligation or bending of the rubber bands, also classically traditionally used for very good for second-degree hemorrhoids. I shall show this in some pictures later. And a bit more serious procedure known as the EUA, examination under anesthesia, and Lord's procedure, which is forceful stretching of the anal canal, which reduces the intra-anal pressure, thereby improving the transit of stools, thereby the symptoms of hemorrhoids. This is usually done as a pre-operative procedure just before hemorrhoidectomy. And the last procedure is of course hemorrhoidectomy, which can be either open or stapled. Okay, open is known as excisional hemorrhoidectomy, and staple known as stapler hemorrhoidectomy. In open hemorrhoidectomy, these days we have the assistance of laser to do the cutting, and as well as the harmonic system to cut using ultrasonic waves, which help to reduce the pain of excision. Okay, this is a summary of the various treatment for the various stages of hemorrhoids. First degree, high fiber diet, stool softness. If bleeding, give injection sclerotherapy. Second degree usually is for rubber banding. Second degree usually rubber banding, and also if it is not so big, hemorrhoids, you can also use injection sclerotherapy. Third degree traditionally is subjected to hemorrhoidectomy, either open or stapling. Nowadays is stapling hemorrhoidectomy. And fourth degree, normally it is either thrombosed and prolapse, so you need some form of local treatment to reduce the swelling, and this is done by the conservative treatment which I mentioned: local applications, analgesics, steroids, antibiotics, either ointment or suppository. This will shrink the hemorrhoids in a couple of days, and then the patient is subjected to stapling hemorrhoidectomy or open hemorrhoidectomy. Okay, and this hemorrhoidectomy can be either stapled or open excisional hemorrhoidectomy. And today, the treatment of choice is stapled hemorrhoidectomy. Okay, another good treatment that is used either pre-operatively for complicated hemorrhoids and continued into the post-operative period is known as the sitz bath. Okay, S-I-T-Z, sitz bath. That is sitting into a bathtub of warm water where you sit immersing your anorectal region into the bathtub. It is done by taking a tub and clean water. Okay, fill it up with clean water after cleaning it thoroughly so that it covers your buttocks. lower back and buttock. Add salt, preferably what we call Epsom salt, which is a salt of magnesium sulfate, which is more potent in reducing edema than normal sodium chloride. Stir it until it is nicely dissolved and sits in the bath for minimum of 15 minutes. It helps in softening the hemorrhoids and reducing the pain and other symptoms associated with the complicated hemorrhoid. After that, you gently wipe out the infected area. To try not to press too hard or cause some scratching, it will cause bleeding. So you do this procedure 15 minutes each time for about 2 or 3 times a day, depending on the severity of the hemorrhoid. This will help you to heal either the operated hemorrhoid or the complicated hemorrhoid faster than otherwise. Okay, these are commercially prepared sitz bath equipment. Okay, it comes with a basin which can nicely fit into the toilet bowl, so you can comfortably sit inside. You can even have something to flush. Add this normal saline and flush your operated area or your thrombosed piles with normal saline, which not only cleanses but reduces the edema and pain of the hemorrhoids. Okay, this is a summary of what is to be done. Clean the tub of doing a sitz bath. Clean the tub, add warm water, add some salt, preferably Epsom salt. This helps to shrink the hemorrhoids further, reducing impact. After that, when it's done, gently clean and dry the infected area. And this is a picture showing injection sclerotherapy, where this is a second-degree hemorrhoid. Okay, 5% phenol or thromboa is taken, usually is around 3 cc, 1 to 3 mils, and then it's injected using a syringe and needle directly into the hemorrhoids. This will cause thrombosis and fibrosis of this hemorrhoid. Thereby, not only stops its bleeding, it also finally obliterates these hemorrhoids, causing fibrosis. This is the bending equipment. Okay, this is the second-degree hemorrhoids, okay, which are pulled into this bending machine here, ligator, which carries the rubber bands. And once it is pulled into the ligator, the rubber bands are released, which strangle or catch the neck of the hemorrhoids, causing ischemic necrosis and fibrosis, or this dropping off of these hemorrhoids. This is a clearer picture. Okay, this is the internal hemorrhoids which are here. They are pulled into the ligator, and then the rubber bands are released and fired to catch the neck of the second-degree hemorrhoid, causing it to get strangulated and fall off. This is an external hemorrhoid, thrombosed. Patient came with severe pain, unable to sit up. So this is due to thrombosis or clotting of blood vessels or veins within these hemorrhoids. So these patients not only need local applications, but most of the time you have to do a minor operation to release these clots and thereby releasing the pain as well. Okay, this is an open hemorrhoidectomy. This is the hemorrhoid that is grasped and pulled upwards. Then using a harmonic knife scalpel, laser scalpel, or normal knife and scissors is cut, and then the neck of this hemorrhoid is sutured. After removing the 3 hemorrhoids, you get a clove leaf appearance here. 3 primary piles excised: 11 o'clock, 3 o'clock, and 7 o'clock. Okay, this is a picture of complete excision of hemorrhoid at all 3 primary sites. Okay, this is another picture of a hemorrhoid here, where you excise through the base and ligate the pedicle. The next one is called stapled hemorrhoidectomy. These days, stapled hemorrhoidectomy has become the treatment of choice or surgery of choice for hemorrhoids. Okay, in this case, it consists of a stapler, 33 mm stapler, okay, with its head and shaft. The head is all anvil, okay. The hemorrhoids are anchored, put a purse string sutures around the hemorrhoids, and these are pulled into the hemorrhoids, are pulled into the stapling equipment. The head is locked to the body, and then this is stapled and cut at the same time. Okay, so this cutting is done within the anal canal, high up in the anal canal. As such, there is not much pain. The advantages of stapled hemorrhoidectomy over open hemorrhoidectomy. It is faster in recovery time, less complications, pain, bleeding, and stricture. These are all very much reduced, especially pain. Okay, patients undergoing successful stapled hemorrhoidectomy are usually ready to go home the next day. They can take a normal diet and be discharged the following day. In fact, after a few hours, when they are much better, patients have very little pain, and they tolerate the operation much better. Also, because of that, they can be early discharged from the wards and go back to return to their job, work as soon as possible. And there's also found newer studies saying there are lesser incidence of recurrence of the hemorrhoids postoperatively. Okay, having said that, we have to know what are the hemorrhoidectomy complications. These are the 4 common complications that we see. The most important is pain, and the pain is usually immediate and severe, especially in open hemorrhoidectomy. So I have to highlight this pain is important, because the pain in hemorrhoidectomy is one that hinders the patient from coming for surgery, okay, procrastinates the patient from coming for surgery for hemorrhoids. At times the pain is delayed, which can last for a week or 2, but normally with treatment, conservative treatment, the pain reduces over the subsequent weeks and months. Second complication is bleeding, which can be immediate or delayed. Delayed complications are usually due to wound breakdown, stapler giving way, or infection. More important is the immediate complication, where the patient can bleed due to slips, ligatures, okay, and this is usually more common in open hemorrhoidectomy and less in stapled hemorrhoidectomy. Acute retention of urine due to pain in the perineal region, patient go into acute retention in the post-op period. This is especially common in males and for elderly males. Okay, so special measures have been taken to treat this urinary retention, which can become very painful after the operation if not attended to. Constipation and fecal infection are another 2 complications that occasionally occur. Constipation is usually these patients are constipated to start with. So after the operation, due to their restrictions in their diet, they tend to become worse. And at times, this feces, hard feces, gets impacted or stuck at the anal region, just above the site of operation. This can become a problem during the immediate post-op period, which can be done under short anesthesia to remove these feces. Infection and abscess formation are another complication, which I told you, especially abscess or portal pyemia is another important and serious complication, which I highlighted earlier. Anal strictures or incontinence, especially strictures are more common, especially after open hemorrhoidectomy, as we see that if you remove 3 hemorrhoids, the chances of getting stricture is much higher due to healing of the anal areas. Okay, I hope my short talk on this hemorrhoids today would have been of great help to you in understanding the topic better. So I see you again in another session. For more videos, lectures similar to these, please visit and subscribe to my YouTube channel at the link below. Till I see you again, thank you.